My name is Casey Rivadello, and I'm currently in my last semester of nursing school at Marian University.
And I am Marta Alcantar, and I am also in my last semester of nursing school at Marian University.
So, we're going to talk to you today about what it means to be in the nursing profession. So, our first question is, what is a nurse and what are the things a nurse does? As a nurse, our primary responsibility is trying to help patients and help them feel better when they're in the hospital or when they're sick.
Some things that we take care of are assessing the patient, using critical thinking skills uh, to see the patient's condition and know when to call the doctor, to point something out to them, give them medications, completing orders from the doctor. So that could be like getting a blood draw or performing a certain type of skill.
So, the kind of patients that I want to deal with, I want to work in pediatrics. I want to care for patients who are like young children, patients who are pretty sick and they have like an extended time in the hospital.
I intend to care for babies in the NICU, and the NICU is the Neonatal Intensive Care Unit, which basically means we care for really, really sick babies. Yeah.
What types of skills or qualities should I have if I want to be a nurse? It's really important that you just have a drive to help people. If you don't have a drive to help people, it's going to really take a toll on you, especially if you're just there for the money. That's a really bad reason to want to be a nurse. You should want to see people get better. You should want to help them along that journey.
And like Casey mentioned, wanting to care for people, having compassion, being very caring, having a good work ethic, and being very hardworking is very important as well.
It's also very important to make sure that you're a critical thinker. Being able to think quickly on your feet and when situations change at the drop of a hat is very important as well.
So what is the process of getting into this field? So you guys are in high school. The first thing you need to do is finish high school, graduate, and then apply to college wherever you want to go, ensuring that they have a nursing school. Once you start college, typically your first year, you will take prereqs, which for us it was anatomy, physiology, chemistry, and microbiology. Once you finish your first year of prereqs, you can apply to the nursing school, and you go through nursing school, and once you graduate from nursing school, you get the BSN portion, which is a Bachelor of Science in Nursing, and then you have to sign up for what is like the accreditation test, which is, or your licensure exam, which is your NCLEX, and once you pass your NCLEX, you get the RN portion of being a nurse.
It's also very important when you're looking into colleges that you want to attend. One, like Martha said, make sure that they do have a nursing program, but it's also very important to look into the nursing program itself. You want to make sure that you're going to a school that's accredited, which means that people have established that they are teaching their students what they need to be taught in order to be successful in the nursing program. If a school were to lose their accreditation, that could affect you, so you want to make sure that you're going to a school with a good standing.
Another important thing when looking at nursing schools is checking those NCLEX pass rates. NCLEX pass rates eventually or essentially help determine if a school stays accredited. If a school's NCLEX pass rate is below a certain level for a couple years, that is when they go under investigation to check for if they should continue to stay accredited.
And ultimately, at the end of the day, you want to make sure that you're getting the best education that you can to make sure that you're giving the best care to the patients that you're going to be caring for. So you want to look into these things not only for yourself and for your security, but you also want to do it for your patient's security as well.
So types of nurses, you can be an RN, which is a registered nurse, or you could be like an LPN, which takes less schooling, and it's in between what would be a CNA and RN, and they do a lot of the same things that RNs do, just with a little tweaks of differences. You get through school faster, and that's one of the choices.
You could also choose to get your BSN to become a registered nurse, or you could choose to get your ASN to become a registered nurse. A BSN is a bachelor's in the science of nursing, and an ASN is an associate's in the science of nursing. This is very important. An associate's degree only takes about 2 years, whereas a bachelor's degree takes about 4. The biggest difference between them is the salary of them, and then also with a BSN, you're more likely to get leadership positions such as like a nurse manager.
So, what should you be doing in high school to prepare to go into nursing school? Well, the first thing is working on your work ethic, making sure that you're doing your assignments, you're getting your work done, showing up to class on time. Because if you prepare yourself with that rigorousness, you'll be more set to enter nursing school, and you'll be less hit with the adjustment that it takes when you get into college.
A big thing is learn what study habits work for you, whether it's working in a group, working by yourself, using flashcards, quizzing yourself. Learn what works for you, because getting to college and trying to learn how to study is very difficult. You're learning difficult material while also trying to learn how to study that material. So if you learn in high school how to study, it'll really help you in the long run. It's also, if you can do it at your school, it'd be great to take science courses, especially human science courses. Like I said, or like Martha said, we take chemistry, anatomy, biology. So those really, if you could take them and get a head start on them, it's really going to help you in the long run understand what they're talking about when you get here.
And along with learning how you learn, which is very important, you should also work on setting really good study habits already. So like that, when you come into college, you already have them in place, and it's easier to just do them. Okay. So please describe your personal career journey to get to the position you have now. So we're nursing students. So to get into nursing school, or how I found that I wanted to be a nurse. So when I was younger, I always really enjoyed taking care of people. And I kind of had an idea of wanting to go into the medical profession. I just didn't know exactly what realm. And then in high school, I took my ACNA course, and that's kind of what solidified it for me. It confirmed that I wanted to be a nurse. And then just sitting through nursing school, there's been a lot of times that I've been very frustrated. Exams are hard, the workload is heavy. But when I go to clinical and I am with my patients and I get to help them, and that's where like I feel that I know that I want to be a nurse even more. It becomes more confirmed, the fact that I was able to help my patient feel a little better. I couldn't resolve everything, but I was able to give them a little bit of relief. I was able to just sit with them and talk to them that day and make them feel a little better.
So when I was in high school, I also took a CNA course. I had absolutely no idea what I wanted to do. I took this course and I was able to go to clinical and help patients, and it really helped me understand that like there are people out there who can't do things for themselves, that need someone else to do it for them. And I've always been super fascinated by the human body, so being able to learn more about the human body while also helping people recover and feel better, just it really rang out to me that that was something that I wanted to do.
So what is the realistic salary range for this position? Well, in the United States, nurses' salaries can range from $48,000 to $104,000.
And in Indiana, it can range from $56,000 to $72,000 a year.
Okay, so how in demand is this type of work in the country and in Indiana? Well, we're always going to need nurses. I think that's one of the biggest things that has always resonated with me, that my parents have told me. People never stop getting sick. They're always going to need someone to take care of them. So the demand for nurses, especially right now with the pandemic going on, is very high, both in the country and both in Indiana.
How has COVID-19 affected your field? So COVID-19 has had a big impact on nursing. We've seen a lot of patients in the hospitals who have COVID-19, especially critically ill patients. They are the patients that have tubes and a lot of medications. They are very sick right now. Also, with the vaccination mandate going on, a lot of nurses have chose to leave the profession, which is leaving us even shorter staffed than we were before.
Last two questions. So, what do you enjoy the most about your chosen career field? My favorite part about nursing so far is caring and being with my patients. Just like I mentioned earlier, knowing that I was able to help the patient feel a little better or feel just a little bit of relief, have someone to talk to, and just have someone else in the hospital that is there to advocate for them and take care of them.
For me, it's getting to meet new people and learning their stories. Everybody has a unique story, and sitting down and talking with the patients, you really get to understand who they are, what has led them to the point that they're at, and I think that it has a huge value in the care that you give them is learning who they are. I also wanted to be able to help and, like I said, learn new things.
So, what are the biggest challenges that we face in the nursing field? Number one biggest challenge right now, and I think that if you talk to anyone in the nursing field, they would tell you is that we are really short-staffed on nurses. The pandemic has really enhanced a lot of problems that we have in the hospitals, and a lot of nurses have left or they have gotten burnt out, and we're just seeing a huge shortage in nurses. So we're gonna need nurses very soon.
Another challenge that we see is the long hours that nurses work. Most hospitals have nurses that work 12-hour shifts. This can be very draining on the nurse, especially if they're not taking enough time to themselves for self-care, refilling their cup so that way they can give the best care that they can to their patients.
And then the final one I will mention is the treatment that nurses receive. For many years, up until now, nurses have been verbally or physically abused by patients or patients normally, or like assaulted, and there was no like protocols for that, and that's something that we have really seen the hospitals work on now. There's codes and protocols set in place for when a patient or a patient's family starts to get aggressive or upset, then you can call in people and they can come help.
The last challenge that I'm going to talk about is feeling like you aren't doing enough for your patient. You could be trying to do everything that you can, and the patient could still get even more sick. They could eventually, pass away. And these things are very emotionally hard on the nurse, and it does definitely take a toll on you. So that is a huge challenge, just feeling like you're not doing enough for them. And we're going to attach, at the end of this video, we're going to put a video on how to wrap a wrist, and then you guys are going to practice, and there's going to be a little competition for you guys. I hope you enjoyed the video. We enjoyed making it for you guys, and hope some of you guys choose to be nurses someday. Bye.
So always wrap from distal to proximal, meaning you wrap the furthest part of the limb first, moving to the closest to your body. And then when you're wrapping, you're really just trying to provide that support to the limb to make sure that it doesn't move anymore, and it gives it the time to heal. And you Velcro it. And you're set. It's nice and sturdy. There's support to my wrist. You're done.